I mean, I think, working the night shift, I work the night shift because I have 3 small children, so I tell myself it makes it easier with that. But I work with a lot of young new nurses, and I mean, I myself am still paying student loans, and I know they are significantly because it's even more expensive for them to go to school. And when you're coming in and getting trained, and then they're working with travel nurses that are making literally three times as much money as they are, why wouldn't they travel? I mean, I could name you 30 nurses off the top of my head that have left within the last 12 months to travel, because it doesn't make sense for them to stay here and make such a little amount of money for the same skill set, especially with the housing prices. I mean, I had to move a half an hour out of Burlington to be able to purchase a home, and it's still, the house across the street just sold for double what I paid for mine. So it's just not, we're not keeping up with, like you said, quality of life here. And and some of the travelers I work with are amazing, but absolutely 100% all of them had said, I would love to live here, but you guys don't even pay remotely enough for me to take a full-time position. They cannot afford to live here. They're like, it would be such a significant change in my lifestyle, I would never accept a full-time job, which is super sad because it feels like this is never going to be fixed. We have 200 plus opening nursing positions, and I don't know people who will come and stay and work here.
Wow, that's really striking to hear that.
Yeah.
In terms of that. So I want to turn to you, Lori, and see how have things shifted in your unit during the time that you've been there. What are some things that you've noticed in terms of CAT scan, and just what are things that you and your colleagues talk about when it comes to staffing?
With CAT scan, even pre-COVID, the increase in the trend of using CAT scan has just skyrocketed in the last few years. And the hospital, we've actually had oncologists fill out safe reports because we don't get their cancer patients in time. This is all pre-COVID. And the administration was aware of that, and even then, nobody was doing anything about it. We felt we were drowning before COVID. Then you bring in COVID, and it all snowballed. So we're just between trying to keep up with all of that, and then it's just people are getting burnt out, like everybody said. And also in radiology, another big issue is they are pretty adamant that we only do 8-hour shifts. And like you guys were discussing the work-life balance, a lot of our technologists are really aiming to get 10 and 12-hour shifts. That the administration has said they don't have it in the budget to let us do that. So we've had multiple technologists leave to go do 12-hour shifts, and the pay increase. Even Dartmouth alone, we had somebody leave for $7 an hour more at Dartmouth. So
it's very much healthcare is very much a competitive marketplace, and you're seeing that people are making those choices based off of that.
Yep.
Even in the region itself,
yes.
You're hearing from people that other area hospitals are paying more.
Yes.
Okay, and that's causing people to leave?
Correct.
What about travelers? Are people leaving to travel too? Is that part of it?
Yes, we have young and old technologists both thinking about the same thing. We've got what I call flight risks. We've got 2 right now that are definitely, he's been around probably 17, 18 years, and then one of our newer ones. So even though we've already lost 10 technologists out of 30, we've got more that are ready to head on out to go travel, specifically for the money.
Sure,
yep.
Sure. And given what you've described, you can see why that would be attractive, not only from a push-out perspective, but also something pulling people in terms of the money that they could be making either at another regional hospital or in a sort of short-term travel gig.
Correct.
Yep. Okay. All right. Well, Sarah, I'm just interested if you might be able to talk about what you've observed from the outpatient side of things in terms of the staffing issues over time. I know you've been an active union member for quite some time, and have been involved in these staffing conversations. So what's your perspective from the outpatient side?
Yeah, and part of it too is I've been the daughter of a nurse that's worked at the hospital for 30 some odd years. So even when it hasn't been my own personal experience at the hospital, I've listened to her share her stories of how things used to be and how things have changed over time. And in talking with other friends and colleagues, it's kind of this, everybody comes back to the same story and the same issue of just this decade plus long, just consistently having the hospital not listen to us and not hear when we've come to them with issues. I mean, this is a conversation that we have had with them over and over and over again, that we've said to them, things are getting bad, like we're going to be in this position. This is what our future is going to look like. And blaming it on COVID is just, it's not realistic. People right now are not leaving the institution because of COVID. They're leaving because of how management is handling things and how things are being mismanaged. And we've consistently seen that they're not willing to step up and address the issues, address the problems, listen to what we have to say about what the issues are, where their priorities need to be. And it's almost this belief that if they don't admit it and they don't say it out loud, that it's not real. But the reality is that it is real. I mean, these are the issues that we're having. And a lot of it is, as you've heard, competitive wages and having that work-life balance. And right now, competitive wages are even more important because we have the fewest nurses that we've seen nationwide to pick from, so to speak. So we have to get creative in how we get people here and keep people here. And that just is not being listened to. We have an employer that is focused on spending millions of dollars on a surgery center that's going to be opened years from now when we're hemorrhaging staff right now. We don't have the staff to staff this surgery center. We need to focus on what we're dealing with right now and coming to the table and working with us to listen to what we need, because right now all that's happening is we're trying to fight this battle on our own without the resources that we need. At best, it's going to take us twice as long to fix, but at worst, we're not going to be able to fix it. And that to me is just, it's not acceptable. And I have to say, for me personally, it's even more upsetting when I think about the number of physicians and nurses that are in high-level leadership positions at the hospital that seem to be okay with the fact that we're in this position and that we're drowning.